And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So as far as preventing teen pregnancies, abstinence is by far the best thing, but what else can you say about that?
I mean, that's real difficult with access that the kids have these days with cars, being left alone, money, etc. It's very difficult to ask teenagers to do that, although that's certainly what we recommend. But these things have been around for some time in terms of preventing pregnancy. The IUD, the implantable device, hormones, birth control pills have been around, and we've been fine-tuning all of those options, and it's good to have that conversation with your gynecologist, your primary care physician, especially if you feel like you're not the strongest person to abstain. You need to be an educated person, and you need to take responsibility for your own life. These sorts of choices can influence or impact what you do for the rest of your life, so it is serious. It's something that needs to be discussed, if not with your parents, certainly with your healthcare professional, and figure out which one works best for you. It's not fit for everyone, so just sit down and try and figure that out, but certainly you need to figure that out before you have a big surprise.
Are there side effects to birth control pills?
We talk about that all the time. Anytime you put a tablet in your mouth, there's potential for side effects, but they've been working on tweaking the amounts of the hormones for years such that the side effects are minimal, but again cannot be completely avoiding of those side effects. Things like blood clots, rashes, any sort of side effects of blood clots is pretty much the biggest one that we've been dealing with. So they work very well, and especially if you take them. But as you know in this segment, compliance is an issue with any medication, even for adults as well as kids. Compliance can influence whether or not they take the medication.
Okay, on to some of our viewers' medical questions. This one says, I'm 74, I have skin tags around my neck and under my arms. What's the best way to remove them? I saw some tag removal at the drugstore, but is this really the safest way to remove them?
Sure, you can try that. I don't have any problem doing that.
What is a skin tag, first off?
It's an abnormal skin lesion. We don't know why they occur, but certainly we see it in patients who are overweight or who have medical problems, diabetes, heart failure, etc. They tend to snag on jewelry or some of your clothes, bra, etc. Just very irritating. Sometimes you can develop many, and it can be displeasing to the eye. So we just clip them off with scissors. Sometimes we can tie them off. Sometimes we use nitrogen just to freeze them off. But yeah, you can use something over the counter if you would like to try it. I don't know if it works or not, but it's certainly something you can try.
But you would want to make sure that whatever you're using is sterile?
Yeah, well, not necessarily. A lot of times with the oil, you're probably just suffocating the skin lesion, and it eventually will just kind of wither away. So I don't know that it has to be completely sterile. Certainly if you're going to snip them with scissors, yeah, you want to try and be as clean as possible, and we certainly do our best to do that in the office when we do that.
Okay, another question. I hear a bubbling sound way inside my ear. It's a constant thing. Sometimes my ear will hurt extremely bad, not always. What can this be?
See, this person probably has fluid in the middle ear. We see that a lot in this area. Sinus or allergy problems is a big problem, so antihistamines, singular, or medications we try. Certainly get an exam, have someone look in your ear. Sometimes you need an x-ray of the sinuses to make sure there's nothing else going on, but it sounds just like fluid in the eustachian tube in the middle ear.
So are you going to have antibiotics for this?
No, not really. We talk about that all the time. We try not to use the antibiotics. Sometimes we are forced, unfortunately. Patients come in, our customers come in, and they want certain things, and so we have to make sure they're happy when they're walking out. But we want to see more fever, some drainage, maybe some yellow bloody mucus before we start thinking about antibiotics.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. And we're back with Dr. Msonthi Levine to answer more of your medical questions. Let's see here. Here's another question. What can I do about my anxiety? I'm on Xanax and it's not working. I get depressed from it. What can I do?
A lot of times you just have to go back to your practitioner and maybe get another medication. Some other medicines we like to use, Effexor, Wellbutrin, citalopram, the list goes on. We have so many medications on the market now. We're trying to get away from Xanax, which is a sedative, a benzodiazepine. As you know, the FDA has made some issues, the DEA, I'm sorry, has made some changes with the narcotics recently. It's a Schedule 2 versus Schedule 3. I see the same thing happening with the sedatives, eventually just more control over prescribing sedatives. It's a dangerous medicine. It's risky. We're just trying to get away from it and use some of the other safer products, understanding that we can never get away from side effects,
right,
but it's certainly less of an issue with abuse and misuse with things like Celexa, Lexapro, Wellbutrin, etc.
Okay, another question. This is a 26-year-old female. Will Medicaid pay for an IUD, or does she have to pay for it herself?
Yeah, I'm not quite sure. Certainly just check with a local practitioner, gynecologist, mid-level, and ask that question. Or you could just call Medicaid yourself and figure that out. I would hope that they would pay for that. Again, giving...
That's a lot cheaper than a child on Medicaid.
Absolutely. You want to give this person
CHIP.
all the options possible to prevent a pregnancy. That brings on so many other financial responsibilities.
Right.
It seems wise. It seems practical and right that they would pay for that, but you never know.
Right. This is a 76-year-old female. She can't make it to the bathroom in time a lot. What could be causing this?
You know, at 76, a lot of times they have mobility issues and they just can't make it to the bathroom when they have urination problems, and a lot of times their bladder function, bladder position is changing, and so it produces a lot of issues with frequent urination. There are medications that can be tried, such as Vesicare, Detrol. Certainly we want to make sure there's no bladder infection. Sometimes it's the medicines, their own diuretics for blood pressure, heart failure, a lot of different issues. It's very common to have bladder problems as a female gets older. You certainly need a thorough workup because it could be one thing, could be three things, but certainly medicines might help this person.
Nothing to be embarrassed about.
Absolutely.
A 73-year-old female, what can help you make you sleep if sleeping pills don't work?
Tough issue again, 73, a lot of times a lot of medical problems, have to get a thorough evaluation, check your thyroid, could be chronic pain, could be respiratory problems if you have chronic lung disease. There's a lot of different sleeping medications, could be anxiety, depression, so sometimes very difficult to treat. Apnea, we talk about that all the time, especially if this person's overweight. So a sleep study at home or in a sleep lab is something that we recommend. Certainly don't over-medicate yourself. A lot of times patients get desperate and they start stacking the medications and they end up in the emergency department in a lot worse condition. So certainly work with your healthcare professional to be sure it's medicated appropriately.
And something that we probably need to talk about at this point, we're going into flu season. Flu vaccine,
That's right.
Get it, don't get it, what do you advise?
Get it. If you're 6 months and above, get it right now. We don't care which one you get. There's a lot of different options out there. Just get one. It prevents spread. That's another big reason to get the vaccine. If somebody gets it and everyone else is vaccinated, it tends to prevent the spread. So yes, go get your vaccine as soon as possible.
All right, Dr. Levine, thank you. We
Yes,
appreciate
ma'am.
you being here. And as always, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like Dr. Levine to answer your medical question, you can fax it at 892-7305. Email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.